It's an honor to be part of this, and I just love that last presentation. I think it was just so right up, and I think our disability studies students over here would love that presentation. Thank you for that. And I'm going to speak about families, and also a lot of what we've learned from families and what that means in regard to aging. So this will be a life course perspective, and I think we've heard this all day, and we need to think about viewing the present within the past and the current tasks to master and the future that you're moving to. And so the developmental phases make a big difference for families. We know there's a lot of transitions as you move from one stage to the next. And then there's many things that take into account. We hear a lot about social determinants and not only the biological kinds of things, but also family, community, state, national policies. All these things we've been talking about affect the autistic person and the family. So what are some lifelong impacts? We know about the cost of care. There's some data that shows projected $549 billion US dollars by 2025. We know that middle and older adult family caregivers of adults with ASD often provide lifelong care. Many live with their families for a long time. We heard from at least some people here that we're talking about still living at home. And there's different ways to think about it. Is it a wear and tear where it becomes more difficult for families, or do families adapt over time? And very much of the focus is on all the negative things. So the stress, the poor mental health and quality of life of families, the greater risk for underserved groups. So we know there's research on that. The difficulties as the persons with autism and the parents age, so all the aging kinds of issues. And we know that the role of the mother is very important in affecting social outcomes. So much of this is very negative, and you're going to hear a lot of negative things, but there's also many positive aspects of caring. And I will go through some of these issues as we talk about families. I will just say that one of the Ph.D. students that is working with me was telling me after she was hearing all these things that people say about the stress of families, she said it was very painful to her to hear that, and went to her family and said, "Am I such a stress to you?" And and what she heard was, of course not, you're very loved. And we hear from many families about the meaningfulness. So I'm going to bring that with that context. We do know there's economic impact for families in terms of reducing work hours, changing jobs, stopping work. We know that caregivers of individuals with IDD are less likely than non-caregivers to be employed. So some of this is not specific to autism. Families of individual with disabilities have lower savings. Economic losses are greater for racial and ethnic minorities. So that's kind of more general. We know that parents of adults with disabilities have higher stress, depression, anxiety, and physical health issues. And there's a greater impact when there's need for behavioral support. We're going to hear that. And this is specific also with autism. When there's compound caregivers, so families are taking care of more than one person, and that the Wang study was specifically around autism. Racial and ethnic minorities, that was around developmental disabilities. We know that social networks are more restricted. Again, that's developmental disabilities. And we know that impacts change over time. We looked at that future planning and community involvement related to more caregiving satisfaction and caregiving self-efficacy, respectively. And also that less choice making of the autistic adult related to greater caregiving satisfaction and self-efficacy of the family member who felt that the family caregiver that they could better help the person. Challenging behaviors and poor health of autistic adults related to greater caregiving burden. So that does come up quite a bit. when we're studying this. And we always try to look not only at burden, but also at caregiving satisfaction and those kinds of aspects. So we talk about some positive aspects. So being a caregiver can be a source of fulfillment and meaningfulness. One of the studies I did on aging caregivers, 80 to 90% of families said that caring for their son or daughter brought meaningfulness to them. And in some cases, some report better mental health and life satisfaction. One of the things that we have found is sometimes there's reciprocity in caregiving, especially to aging parents, and that people with disabilities can also be caregivers. And more recently, Katie Arnold has a dissertation where she looked at that with families and found many situations where the adult with intellectual and developmental disabilities was caring for an older parent in different ways. There's also, and this is specific to autism, resilience among caregivers associated with positive social support, higher quality of life, self-efficacy, problem and meaning-focused coping styles. So Chakurian looked at resilience among caregivers. So I think we need to look at that. I will say, and we're talking about medical model and social model, that I was at a conference a bunch of years ago on family support, and they came out with a consensus statement saying all families of people with intellectual and developmental disabilities experience extreme stress. And I objected to that comment because, well, you know, I'm embedded in disability studies and how we think about that. And the person who wrote to me, maybe you don't know about families, or which of course I do, also personally in my family. But the argument was, if you want services, you need to show a need. If you want family support services, you need to show that families are really stressed. So I understand that, and I think we heard that before in the presentations, I think from Dr. Shore, about sometimes you have to use the medical model for something. The impact on siblings, and I know Gail Orsman has written about it, and we've written about that, and that sisters tend to be more involved in care of adult siblings with autism, no big surprise. As get older, the siblings become more and more involved in care. And the worst combination is a female with an autistic female and a typical brother. Some of the negative factors are a family history of depression, especially in the mother, and stressful events. Positive factor for families is getting family support. And I think that's something we can talk about some more. And sibling well-being and close relationships are bi-directional. So you see a lot of great relations with siblings, and they help each other. And there's less positive relationships if there's more challenging behaviors, and that's from study of Gail Orsman and Fulford, who've been looking at siblings. We did a review of the literature on relationships, and we found that in comparison with siblings of adults with Down syndrome, the siblings of adults with autism had less contact with the sibling, less positive relationship, worse relationship with their parents, and worse health. So I'm not sure that's the most helpful way to think about it, but these were studies that were done that looked at that. In terms of sibling supports, I was one of the co-founders of the Sibling Leadership Network, and I have a sister that has intellectual and developmental disabilities. And the Sibling Leadership Network is about advocating for and with our siblings. And we now have 27 state chapters. We have SibNet with over 5,500 subscribers to that. I know there's a project very specific to siblings and autism that Gail Orsman is involved in called Forward, focusing on relationships, well-being, and responsibility. That's looking at future planning, which I will talk with more. So in looking at through the lifespan, we looking at the interaction of aging and IDD and life transitions, and look at how this relates to families. So we know that as people get older, there's development of chronic health conditions, both in the family and the older adult, changes in family caregiving and supports as the families are not able to care anymore, or at least the parents, retiring from employment, another issue, and receiving end-of-life care. So all these aspects affect both the family and the person. So some of these issues in adulthood and aging, some of these we've heard about, but I try to look at how they impact families and how families impact the autistic person. By the way, sometimes I say adults with autism and sometimes I say autistic adults. I think the more preferred these days is autistic adults. So they continue to live at home and are unemployed or underemployed with no pension. So we've heard about that. We've heard about the high rates of medical and psychiatric conditions and how they can stabilize, reduce, or increase. The difficulty in finding doctors with needed expertise. And as we heard, that people often need their families to help them with this. There's some reduction in behavioral symptoms, some earlier age-related chronic conditions, and we heard about some of the reasons, needing to address end-of-life issues, both for the autistic person, but also families, and sometimes, having to deal with grief. Challenge for aging parents who have fewer supports, and then the fact that siblings take on greater roles. So we know there's also a lot of unmet family support needs as we're looking at adulthood and aging. And the role of families is more formalized in schools. And so, after schools, things are not the same. In school, certain kinds of supports are required, but there's much less supports as people become adults. And especially, we heard about so many of the unmet needs around mental health and psychiatric hospitalization, a lot of these things. Among families of people with disabilities, this is a study we did on managed care. Those included people with autistic people who wanted a specific service. Over 2/3 had an unmet need for support groups, meal services, and respite. And nearly half had an unmet need for assistive technology, home health care, home modifications, and training or education for future planning, which I'll be talking about more. We know there's a need to plan for future needs, and we did hear about that just a little bit today. And many families do not make plans and experience barriers. They may be unaware of legal and financial options. It can be very complicated. There's fears for the future unknown. There's always anxiety around thinking about when you can't take care of people, or when you may become more frail. There's difficulty identifying caregiving support for the future. Sometimes you hear families saying, well, it's one thing for me, but it might be hard for the siblings. The difficulty in getting the process started, having little contact with and mistrust of the formal disability services. Many families have not used the disability services that are older. So the younger families, they may be much more used to it. But some of the older ones, and especially among some racial ethnic groups that are using it much less. There's a lack of collaboration between the aging and disability service system, which I will talk about some more. And there's simply age-related needs and daily demands of families. And we know that planning is related to resources, the ways people cope, and what kind of options are in the community. And I've heard families who say, how can I plan when we don't like the options out there? So how do we support families? Certainly public policies. We've heard about governmental support and the kind of work that Senator Casey's office is doing, some examples of that. Cash subsidies, consumer-directed support, various psychosocial interventions. So I will talk about some of that, particularly around the work on future planning that we've been doing, but any kinds of support groups, support coordination, and natural community and informal support. We know that for many families, they're not getting, very few families are actually getting family support. Generally with IDD services, about 15% of families are getting some kind of family support. I mean, very few. And I'm talking about in cases where people are living at home. There's a community of practice for supporting families, and which is dedicated to positive systematic change. It's through the National Association of State DD Directors and also the University of Missouri. They have 19 states participating, and there's something called, should have an H there, Charting the Life Course. And so they have a good website, and you can see some of what they're doing. They're really trying to make systematic change. There's a program that Sandy Magagne developed, Caring for Myself. And this was through the center that we had on Rehabilitation Research and Training Center on Aging with developmental disabilities, and this was part of what she developed. And it's a health promotion program for Latino mothers age 50 and older of IDD adults, and 30% had adults that had autism. And these were modified to be culturally relevant, and they used promotoras, which are peer mentors, which were family peer mentors. And this was a evidence-based kind of study, randomized, and they found increased self-efficacy and in being able to help their autistic adult children, and better self-care, nutrition, and less depression. We developed the Future is Now curriculum, and we've been fortunate to get a grant to do a whole virtual version for the next 3 years, and research on that through NIDLR, National Institute on Disability, Independent Living, and Rehab Research. And the overall goal is to help families make future plans and develop goals related to future plans, develop letters of intent, which is kind of a roadmap to all the different aspects, increase advocacy for these supports. We have facilitator guides and work groups. We really look at all the different domains, from kind of taking the big step to really deal with future planning, to thinking about building relationships and self-determination. How do we support community living, education, work, retirement options, and keeping the dream as we age? And these are some of the unique features. It really integrates person-centered and family-centered philosophies. And we've been talking about the importance of the view of the person with disabilities, and it's very much centered on the person with disabilities. In fact, we do the training separately and together, and it really helps facilitate families discussing together and coming up with sort of problem solving around what they want. We include peer trainers, includes people with IDD, and we also have families who have gone through doing this kind of future planning. So we have both as peer trainers. And many of us that work on the project, we have autistic adults working on this project with us. And we also have a lot of community partners, et cetera. There's problem solving around these family dynamics and family values. Sometimes people don't necessarily agree. So the person, the autistic person may have a different view, and different siblings may have different views, and the parents may have different views. So it's really trying to work that through. The letter of intent includes the essential information about the individual with the disability strengths, preferences, interests, support needs. It's very much about what they want, and not just what options are out there, but what they really would like to see. And again, I want to emphasize it's both person-centered and family-centered. You have to think about both. And it identifies goals to expand friendships, to make future living arrangements, arrange for post-secondary education, work, retirement, and to designate a successor caregiver. We did research in this area. It is an evidence-based. We had a pre-post randomized design. And some of the findings we had was an increase in future planning activities, writing letters of intent, preparing special needs trusts, initiating planning for future living arrangements, reduction in caregivers' burden, and increase in the daily choice making of individuals with IDD. And what was important in this is that families were less worried after this. This is really the main item that on the scale that we had that they endorsed that changed because of the training. We are now transitioning to do it virtually. I would say we couldn't get this funded before, but now with the pandemic, they thought it was a great idea to do it virtually. So we're working with 8 states. We were able to use Zoom for real-time interactive sessions separately with the autistic and people with IDD, and separately with the families, and also together. And we also work closely with the ARC. They have a wonderful future planning center with lots of resources, and so they are partners with us. We know that family support makes public health and financial sense, and that family support is associated with positive family outcomes and better family quality of care, less caregiving burden, more caregiving stature, and more self-efficacy in helping the family member with a disability. We know that unmet service needs are associated with decreased mental health for female family carers. And we know that respite and supplemental services have been linked to lower caregiving stress, less depression, decreased caregiving burden, improved mental health. And that psychoeducation interventions have shown positive impacts for families. And I know that AARP has tried to push, they had a special initiative to try to push that managed care, because so much of the Medicaid has gone to managed care, and trying to really push Medicaid to actually provide family support as part of what they do. And some of them say that they do, but when you really look at it, they really don't do that much. And then there's the challenges in bridging aging and disability. There's been a historical segmentation of service systems. There's different philosophies, terms, and definitions, distinct fields of knowledge and practice. You'll see that the research is really separate. There's very little. We've done 2 reviews to look at where it intersects, and very little. There's protection and duplication of funds, and missed opportunities for knowledge translation, innovative policy change, and co-funding. I think it's wonderful that Casey's office and that subcommittee, the Committee on Aging that they have endorsed disability policies. And now we do have ACL that really does try to bring in aging and disability. So some of the collaboration with the Aging Network, the RAISE project is really across both, which is recognize, assist, include, support, and engage. Family Caregiving Advisory Council, they have people from the aging and also from the disability world. There are cross-training activities. We recently got a grant on bridging aging and disabilities, and actually the National Association of DD Councils got that grant. We're a big part of it, along with the ARC and Brandeis, and also some aging groups, and that's to really look at families and also bridging aging and disabilities, and that's funded by ACL. And there's commonalities in needs for long-term care. We have the Aging and Disability Resource Centers, research we've done and others have done. I would say the D is very small in it. It's really much more around aging, but they have done some things that do bridge the 2 networks. The National Family Caregiver Support Program does help families that are caring for adults with developmental disabilities, and that's kind of always been in there, but sometimes they have done it and sometimes they haven't. The National Alzheimer's Project Act does include people from our network. There's a National Task Group on ID and Dementia, and not necessarily doing autism. So that might be something to look at. We don't really know too much about autism and dementia, but we have some researchers that might know more about it that will be presenting as part of this conference. And then service providers need to assess the family support needs provide family support, respite, stipends, psychoeducation training, and peer support. We need to increase support to families for behavioral support and for help with complex health care. And we need to balance the person-centered and family-centered support with self-determination of the autistic person, because as we know, they may not feel the same way. We do need to culturally tailor information, service, and supports to accessible for caregivers from various racial, ethnic backgrounds. I know Sandy Magana has been doing a lot of work in that area with Latinas. She used to be with us, and now she's at University of Texas, but she does wonderful work in this area. We need to develop, expand, and pay for the workforce of personal support workers, including paying families. We've looked at that, and more than half of the personal support workers are actually family members, at least through the IDD system of who's being paid for that. We need to consider other family members, siblings, grandparents, others. And we need to bridge aging and disabilities in community education, outreach, research, and supports for caregivers. So I stayed in my time, and here's my contact information. Thank you for the opportunity to talk about this.